Obviously, we mentioned the patient, for those who don't know, is the person that comes to your practice because they have a particular problem. So we refer to a patient as that particular individual. The customer is the person who purchases something from you, whatever it is, or someone who pays for a particular service. And the client is the person that keeps coming back. So the customer might not necessarily be someone who purchased something from your particular practice, but the client is the one that keeps coming to the very same business. All right. And so this next session of the training looks at the different components of all three. There are certain defining characteristics of the patient, the customer, and the client. Number one question for the patient, anyone? What do you think a patient will ask as a question versus what a customer will ask as a question versus what the client has as a question? Here's the chart. Can everyone see at the back there? It's too small. All right. So we've written down here, the patient will want the diagnosis of their problem. So you need to be very clear and specific when outlining what is wrong with whatever it is that they're complaining about. Whereas the customer, remember the customer has already received glasses, whether from you or elsewhere. They want you to outline what the current prognosis is and detail the benefits of what they received. So for a practical example, don't take it for granted that people know. So if it's a customer that is wearing glasses for the second time, make sure that you get as much information from them in terms of how was the visual experience, how was the lifestyle experience, how was the overall experience with the solution that they had received from the previous time. Did it meet all their expectations? What were the concerns that they had which they want you to address today when they come to your business? So that, for example, when you say, when you outline what the current prognosis is, you're telling them what to expect going forward with regards to their vision. So it's very, very important that as the optometrist in the practices, you explain that in those meetings that we mentioned, what vision a person who with a -1 is actually seeing versus a -5 versus a -5 with a -3 cell. So from time to time, get into those explanations with the staff. The more you do it, when a patient comes or a customer comes in for a collection of their glasses and the file is there, but this person is a -2 or -3, but they come in and they're not wearing their glasses or their contact lenses. When the particular staff member dispenses a particular pair of eyewear, for example, they are able to confidently, we'll see there's a screenshot later on of what needs to be on the file, where they will be able to look at what's on the file and say, sir, just remember, this is how you're supposed to wear your glasses. So you'll see now, whereas the client wants to know, are you ready for their return? That example we made earlier on of Mr. Breitenbach, who has been coming 6 years in the practice, but you don't know that he's Mr. Breitenbach, needs to change. The answers required the most by the patient is they want to know exactly why they have the problem, what causes it, and how it can be solved. And will the solution be permanent? So with the patient, give them as much information as possible so that you're starting them off with the best possible solution. Because if you give someone the basic, you're going to find it very difficult to upgrade them next time they come to your practice. But if you started them off with the very best, so even that individual who comes in with those medical aids that are on a package, and they only are having, let's say they only have, 600 rands or 600 plus as their medical aid optical benefit portion, your responsibility is not to provide them with what the medical aid pays for. Your responsibility as a practice, especially the optometry staff, when you are explaining that, sir, let's say Magnus wrote on the test card, single vision ARC transitions, and you're also ordering contact lenses. But the medical aid says that individual only wants only has 660, for example. And now you can't explain further with regards why you're prescribing what you're prescribing, because your next patient is waiting. And you give the test card to your staff member. The staff member's responsibility is not to take that particular individual to the frames where the packages are offered. Worst mistake. You sit them down. Always remember, before you dispense anything, have the discussions first. So on your test card, you might even, I don't know how your test card looks like, you might have to consider rewriting your test card so that the section that has to do with what you're prescribing is not just 2 lines where you've just written single vision ARC transitions. You have written, you might have to do that in the beginning, or have a separate sheet for the staff that mentions single vision ARC with transitions. These are the clinical features and benefits of it. Multifocal ARC with transitions, these are the features and benefits of that. So the staff member, each staff member needs to have like their own private file like this, very small, with those little quick tips that they have. So that you know in your private time, you have already gone through that in as much detail as you possibly can. So when you're explaining to the particular patient who only has 660 on their medical aid, and you have set them down to discuss, you are going to say, sir, the optometrist has prescribed the following for you. These are the benefits you should expect to, or this is the experience you will get with what's been recommended, and these are the benefits of the anti-glare, the transitions, whatever it is that the optometrist has written down. Remember, the frame is not there yet. Don't get into the discussion of pricing too quickly without having established that this person fully understands what is wrong with their vision and what it will take for that vision to solve it. So that when that person really cannot afford to pay for the anti-glare, to pay for the transitions, you are in a confident position to explain that which they came for, they will still be dealing with going forward. And it answers that question of, ever since I've been wearing these glasses, my vision is not right. Yes, sir, your vision is not right because you are supposed to have anti-glare, not just any anti-glare, this kind of anti-glare. So you get more confident. The more you do it, when should you do it? Every patient. Should you sit down with every patient? Yes, unless your patient sees patients every hour on the dot, every single day. If that is the case, then when we leave here, Mr. Rada can send us an email. We will find you a dedicated dispenser who will work in that particular practice, and that person's job will be to do exactly what I've just described right now. But if that is not the case, and there is time in the practice to really have those discussions,